South Korea, previously celebrated for its remarkable economic growth, is currently grappling with a critical demographic issue: a decreasing birth rate and a population that is getting older. In recent years, South Korea has experienced a decline in its birth rate, leading to concerns about the country's long-term sustainability. This phenomenon, frequently called South Korea's dying out, arises from an intricate interplay of socioeconomic, cultural, and policy factors. Various factors are influencing the country's demographic landscape, including high living costs, intense education pressure, gender inequality, and changing social dynamics. It is essential to grasp the underlying causes of South Korea's demographic challenges to develop successful strategies to tackle them and secure the country's future well-being. The birth rate in South Korea has been consistently decreasing for several decades. Several factors contribute to this situation, including socioeconomic aspects like expensive cost of living, demanding work schedules, and the financial burden of childcare and education. In addition, cultural influences come into play, as numerous young individuals emphasize their professional pursuits more than beginning a family. The societal expectations on South Korea can often result in individuals postponing marriage and having children. South Korea has undergone a remarkable economic transformation, transitioning from an agrarian society to becoming one of the world's top industrialized nations in a relatively short period. Nevertheless, this expansion has had its drawbacks, as daily life expenses, especially in bustling urban centers such as Seoul, have surged. The exorbitant housing prices, education, and healthcare pose significant obstacles for young couples hoping to begin a family. Despite advancements in women's rights, South Korea continues to grapple with substantial gender inequality, especially within the professional sphere. It is unfortunate that many women still encounter unfair treatment and barriers in their professional lives, which can hinder their financial autonomy. In addition, the societal expectation that women should primarily handle childcare and household tasks can pose significant challenges for women who aspire to have successful careers. This imbalance adds to the concerns of women when it comes to starting a family, as they worry about how it will affect their professional lives and personal autonomy. Academic and career success are highly valued in South Korean society, sometimes overshadowing personal relationships and family life. The expectations to succeed academically, land a high-status job, and uphold a specific lifestyle can feel like a heavy burden for young individuals. The pressure to conform to traditional gender roles and family structures often discourages individuals from starting families or having more than one child. Despite the South Korean government implementing various policies and incentives to promote childbirth and assist families, such as childcare subsidies and parental leave, the results have been modest in reversing a downward trend in birth rates. Implementing more comprehensive and effective policies that can effectively tackle the underlying factors contributing to the demographic crisis is crucial. Based on data from the World Bank, South Korea has experienced a significant decline in its total fertility rate over the years. In the 1960s, women in South Korea had an average of around 6 children in their lifetime. However, by 2020, this number has dropped drastically to just 1.1 children per woman. This figure is well below the replacement level of 2.1 children per woman, which is necessary to ensure population stability. The number of elderly individuals in South Korea's population is growing rapidly. Based on data from the Korean Statistical Information Service, there has been a significant increase in the percentage of the population aged 65 and above. In 2000, this group accounted for 7.2% of the population, but by 2020, it had risen to 14.9%. If current trends persist, this percentage is projected to continue to rise and reach nearly 40% by 2060. South Korea is well known for its education system, which is highly competitive and places a lot of pressure on students to excel academically from a young age. The pressure that individuals face often continue into adulthood as they strive to secure spots in highly regarded universities and find stable employment. Many young individuals choose to focus on their studies and career growth, which can lead to a delay in getting married and having children. Based on OECD data, South Korea stands out among OECD countries with one of the highest tertiary education attainment rates. This indicates that many young adults prioritize their education over starting families, dedicating more time and resources to their personal growth. The exorbitant housing prices in South Korea's bustling cities, especially Seoul, have emerged as a major obstacle for young people aspiring to begin their own families. As per a report from the International Monetary Fund, IMF, the surge in housing prices in South Korea has outpaced income growth, posing a challenge for young individuals to purchase homes. Rising housing expenses compel numerous young couples to postpone marriage or having children until they can establish a more secure living situation, exacerbating the country's decreasing birth rate. Despite South Korea's impressive economic progress, the nation still faces challenges in providing strong social safety nets for families, especially those with young children. Access to affordable childcare and parental leave policies often pose challenges for parents, particularly mothers, in juggling work and family obligations. Many young couples may hesitate to start a family due to concerns about the financial and logistical challenges of raising children, especially without sufficient support systems. South Korea has seen a notable increase in the number of people leaving the country, especially among the younger generation, who are looking for improved economic prospects and a higher quality of life overseas. Many skilled professionals and young families are leaving South Korea due to the appeal of higher wages, better work-life balance, and more favorable living conditions in countries like the United States, Canada, and Australia. This phenomenon is often referred to as a brain drain. The departure of skilled individuals and potential caregivers only worsens the nation's demographic difficulties and economic prospects. Based on a report from the Korea Institute for Health and Social Affairs, South Korea has consistently declined its fertility rate over the past few decades. In 2020, the rate hit a record low of 0.84 children per woman. Several reasons behind this decline include increasing academic stress, challenges in affording housing, and insufficient support systems for families. According to data from the South Korean Ministry of Interior and Safety, housing prices in Seoul have skyrocketed over the past decade, leaving many young people struggling to afford their homes. The price increase has far outpaced income growth, creating a significant barrier to home ownership. The soaring prices of housing have become a significant factor in the decision of many young couples to postpone getting married and starting a family, exacerbating the demographic issues faced by the nation. Statistics from South Korea reveal that the average age of marriage has been on a consistent rise in recent decades. Many young adults are opting to postpone marriage or embrace a single life. There are several reasons why people are choosing to delay getting married and having children, such as financial pressures, shifting societal expectations, and personal lifestyle choices. A recent study published in the Journal of Population Economics revealed an interesting correlation between the amount of student debt and the timing of marriage and childbirth among young adults in South Korea. The significant obstacle of student loans and education expenses has been identified as a major hindrance to starting a family, especially for couples with limited financial resources. The South Korean government has implemented a range of measures and programs to tackle the issue of the country's decreasing birth rate. These include providing financial incentives to couples who decide to have children, increasing support for childcare through subsidies, and extending the duration of parental leave. Nevertheless, the attempts made so far could have even more effect in changing the demographic situation. This emphasizes the necessity for more extensive measures to assist families and promote childbirth. South Korea's declining population is not solely attributed to one factor, but a combination of interconnected issues. Addressing the complex issues necessitates a holistic approach considering economic pressures, societal expectations, cultural norms, and policy shortcomings. Although the government has implemented measures to promote childbirth and assist families, their impact still needs to be expanded. To combat the declining birth rate and counteract the effects of an aging population, South Korea needs to implement comprehensive strategies that tackle the underlying causes of its demographic issues. Ensuring gender equality in the workforce, strengthening social safety nets, and encouraging a healthier work-life balance are essential for securing South Korea's demographic future and maintaining its prosperity.